healthy living with Intermountain Healthcare.
We are battling opioid abuse one prescription at a time. Intermountain Healthcare is taking steps to reduce the risk of opioid dependency and misuse in our state. And Bridget Shears from Intermountain Healthcare is joining me now with more information. How are we doing? How is Utah doing in the fight against opioid abuse?
Actually, we're doing much better than we had in the past. So this year, we actually had a report from the CDC showing that we had a 12% reduction in the number of deaths due to opioid misuse. So that's great news for us.
I love to hear that. And a big part of that was that Intermountain Healthcare played a role. They made it a goal in the year 2018 to significantly reduce of opioids and how many we're prescribing each year. Why did that become a goal, and how did that all come together?
Well, if you recall, probably about 3 years ago, in 2016, there was a report out that Utah was one of the top states in the nation for deaths due to opioid misuse. We were number 4, and we said we need to do something about that. We had a community health needs assessment that identified opioid overdose as one of the biggest needs of our state at that time, and we developed a team to figure out how could we improve this, how could we help our community and reduce the number of deaths. It's not an easy task at all, and just by putting together the right people and really thinking about what should we be trying to do, where is the problem, what kind of things are we seeing that we can change, that we can have an impact on, that are happening right here at Intermountain Healthcare. And that was what we did. We saw that we were prescribing a lot of opioids for acute pain, which is very severe pain, but it really doesn't need to be prescribed for very long periods of time. So we really thought about what is the evidence behind why we are prescribing opioids the way that we are, and we really didn't have a lot of basis for prescribing long-term and a large quantity of opioids for acute pain conditions.
Bridget, is it about education? Right, a lot of education, starting with medical professionals, but also for the patient.
Yes.
I'm thinking too.
Yes. So we developed an organization, a collaborative across the state, the Opioid Community Collaborative, which were Intermountain Healthcare, the University of Utah, the Utah Department of Health, and several other county health departments to say, what can we all do together to have an impact on this? And one of the things that we recognized is that we needed a group of individuals to work on at least 3 things, right? First of all was public awareness. How do we educate our public about what's going on with opioids, how to take them properly, how to have a conversation with your physician about opioids if they're being prescribed for you. Provider education, yes, getting in front of our physicians, in front of our nurses, and having that conversation with them about talking to their patients about opioids. And what is the right amount to give a patient? How much do you really need for acute pain conditions? We also recognize that if we're going to be asking our providers and our patients to think differently about how they are prescribed opioids, we need to make sure that we have a way to treat patients. So we also had a group that worked on treatment too.
Alternatives.
So yeah, how do we do things differently and help those patients that we know have problems with opioids, that we can help them get better without those opioids.
Bridget, let's talk about that a little bit. We know that in addition to decreasing prescriptions by 3.8 million last year, incredible, Intermountain Healthcare is also increasing medication-assisted treatments for opioid dependency. What does that mean?
So we know that there are some medications, specifically buprenorphine, Suboxone, and Vivitrol, that can help patients reduce the cravings for opioids. Opioids tend to change the way that the body responds to the medication, and they become very dependent on the medications. So one of the things that we can do is provide them with an antagonist medication, which is the buprenorphine, and that can help patients with those cravings and help them reduce the amount of opioids that they're on.
Are these people who are already dependent, or are these people who you're prescribing an opioid that they take simultaneously?
No. These are for people who have been on opioids for a long time, have some dependency, and they can be treated with the buprenorphine.
What can our viewers do at home to help you with your efforts?
Well, I think one of the things is becoming more informed, learning about it. Also, if you know of someone who has an opioid dependency or an opioid use disorder, that there are agencies in our state that can help you with that and get you on buprenorphine and work with you. And our treatment programs include mental health training, counseling as well. So.
A lofty goal that was accomplished. I love that you said at the beginning. It's worth mentioning again. The CDC reported in August, Utah, one of 12 states that saw a decline in opioid-related deaths.
So by 12%, we reduced the opioid deaths in Utah.
If you want more information, everybody, please go to our website. We will link you to Intermountain Healthcare's website, goodforutah.com/GTU, and you can read about what they are doing. Thank you so much, Bridget.
Thank you
for being here.
Appreciate it. All right, everybody, coming up next, if you haven't tried tofu,